Welcome back to yet another decade of content. So today, finally, after a long time, we have thought of talking about low back pain. Majority of us suffer from a low back pain in our lives. As a matter of fact, it is the 80% of people in this world suffer from some kind of a pain in their back. There are a lot of other reasons why we have pain in the back. For that, we need to understand the anatomy of the back. Because it's not a straight line or it's not a straight arrangement of the bone, that is the reason why there is a lot of push and pull among the bones which is there in your back. So we divide the bone accordingly. The more interesting part is basically on the lumbar. The lumbar is your low back. The entire body's weight is basically focused on the L3 and L4 sector. When we say L3 and L4 is how the body defines itself as a center of gravity. So the body's entire weight is basically focused on your lower back, that is L3 and L4. So if you take care of that part, then majority of your stresses and strains can actually reduce on a long run. So what exactly or how we can decide on what kind of a pain we have? Majority of us have something called as mechanical back pain. And some we can say it's because of a non-mechanical where we have third party involved, like that of infection, that of cancer, or that of metabolic disorder like obesity. And also primarily there might be some kind of an inflammatory reactors which are there in the body which can lead to your back pain. Apart from the spinal causes, there can also be specific diseases which are not related to spine, but still you have some kind of a back pain. So one such thing or one thing is gynecological. When we say gynecological, pregnancy is one big area where we can actually look at back pain as such. People who are undergoing cesarean section, people who have been into cesarean section as such, will understand after cesarean, uh, basically you tend to feel more back pain or you have an issue of back pain on a successive period. So that is the reason why we generally advise people to go for natural delivery rather than cesarean section, because the spine has the weight of the baby. So once the baby gets out of the birth canal, then the spine comes back to its normal position. That is the reason why we generally ask patients, especially the system where we are practicing, there is yoga naturopathy, we try to emphasize more on natural birth rather than cesarean birth. Apart from that, we have renal cause, because renal kidneys are very much in line with the back area. So we feel that because of a stress from the kidneys can actually trigger, which we call as referred pain, can be seen at your back. Aneurysm and pancreas are also one of the causes. Aneurysm is just the arteries of your blood, major blood vessels, that is renal artery, get colluded and it can bulge out of its way, and that pushes more pressure onto the muscle that can make sure that you have a back pain. Same time, pancreatitis, it's basically a referred pain. So the nerves which are supplying to pancreas also supply to your back, and similarly you can have pain in that area. So we'll go on try to understand how mechanical pains come, because this is the major part of our understanding about back pain. So it might be because of a muscular spasm. You might have fallen down and there must be a muscular tear or some kind with where you have overstretched your muscle. Also your posture, very important. If you don't take care of your posture, you tend to have kind of imbalance in your body. And also intervertebral disc prolapse, which we commonly call as a slip disc. It happens because of dehydration of your slip or your the disc between your two bones. So that slips because of dehydration, and that can end up costing you a little bit of back pain. Also spondylosis and spondylosis. These are the two things where the disc, the bulge between the disc is more prominent, and that can lead to impingement, and where the nerves are getting they're hit by the nerves, and that doesn't allow you to move for a long time. At the same time, we have spinal deformities like spina bifida and other things which we can see. At the same time, we have sciatica. Sciatica is where there is a root, let's say there is a nerve which passes from your bones to your legs, and the bones has been compressed because of your mechanical pressure, and that can lead to a pulling type of a pain running down to your heels till the back of your back. So this is an entire stretch of pain which you can exercise, which you can feel when you are actually doing this, when you undergo some kind of a sciatic problem or sciatic injury as such. So these are the few mechanical pains which you can come across. At the same time, there are also non-mechanical back pain. As I said, metabolic, it can be osteoporosis, it can be fibromyalgia, Also, neoplastic, as I said, it's basically cancer of the bone, cancer of the or some kind of a cancer which is lodged somewhere and it comes to your spine. It can also be infectious, where it can be tuberculosis, a very common infectious spine disease, where the organism, that is tuberculosis or organism, gets lodged in the canal, and that hampers the functioning of the spine as such. So apart from this, we also have inflammatory diseases, which generally occurs at a very young age, where the body sees the same structure and doesn't recognize it and tries to overcome or overpower it. For example, there are some mediators in the body which will be taken care by the body, but it fails to understand that it's a part of the body. So what happens is it becomes an arthritic kind of a pain, where movement or the bone itself tries to dissolve its cartilage and becomes a bone in structure. So all these soft tissues which are there between your bones, it just replaces with the calcium, what we can say is ions, and those calcium ions can actually, make that entire stretch of your spine very hard. So you can generally lose the curvature of the spine. So what does the treatment talk about? Alternatives of back pain is very vastly accepted. Ayurveda talks about it, naturopathy talks about it, yoga talks about it, but also allopathy talks about rest. The initially very important is whatever happens, you need to take care of your body. So pain is an indicator that something is wrong with your body. So you need to get your attention, you need to get your focus onto that part. So pain is not just you take some medications and then, you can just forget the pain. That is just, blanking or masking of the pain rather than removing the pain. So allopathic, talking about it, they talk about being more restful. So you take 2 weeks of a rest of your any kind of a pain in your back. And also, if possible, they try to give you analgesic, that is the medicines which reduces your pain symptoms. If it doesn't recover, then they advise majority of the times to go for surgical interventions. Apart from that, in naturopathy, if you go visit any centers, you will be having hot fermentation, you will be having spinal spray, you can come across hip bath. These are the hydrotherapeutic practices which will ease your pain of your back. Similarly, you can have acupuncture, you have physiotherapy, you have chiropractic. Chiropractic is nothing but manipulation of your spine. So the entire spine, they try to push and try to pull and make sure that the pain or the managing the pain becomes much more easier with just a little bit of compression, with a little bit of traction. At the same time, yoga talks about majority of the asanas. Yoga is entirely about asanas, pranayamas, and how do you try to get the rhythm of your back, the rhythm of your body with power without having any substantial damages to your spine. But what as a viewer from home, what you can do is, these are the few things which you can actually do it at your home. This is something, as the picture says, it's more about a chair relaxation. So you just lie down on your floor, let your so-called thighs be perpendicular to the floor, and relax your calf muscles on the chair's position where you sit. So there is a 90-degree angle made of your knees and the 90-degree angle of your hip joint. So when the two 90 degrees angles are perpendicular, when they are at the 90 degree, then you can see that your spine is actually flattened. So you can see that your spine is more flat. So that reduces the compression of any kind of rather than compression, it reduces the stretch which the muscles are exerting. So that should reduce or relax your muscles much more faster than standing or just sleeping. So along with that, what you can do is, as a precautionary measure, whenever you are trying to lift anything, so you try to bend your knees. You are not shifting, as I said earlier, the center of gravity of your body. So see to it that you maintain the center of the gravity at L4. So when you're moving forward, the center of the gravity is pushed a little. When you're moving backward, the center of gravity is pushed a little. So maintain the same center of gravity by bending your knees, lifting the object. Don't try to keep your knees straight when you're bending the object. So whenever you have a little bit of pain, see to it that, like how you have taken a rest, similarly, try to keep a hot substance. You can keep a hot towel, you can keep a hot water bag, you can even keep hot pads. So that will make sure that the circulation to the local area increases, and that will ease out the pain. So also, sleeping is also one such thing. When you are sleeping, see to it that your bed is not very soft. If the bed is too soft, then the body's entire structure or the posture gets a little bit of up and down, and it creates an imbalance for your sleeping. At the same time, if it is too hard, then again the neck and the thoracic, that is the middle back, will take a little bit of beating. So that is the reason why I choose a bed which is soft, at the same time not too soft. So whenever you have a pain or whenever there is some kind of a irritation in your back, see to it that you apply some oil, whichever oil. It might be coconut oil, it can be any kind of a pain oil which is available in the market. A little bit warm it up so that the warmth of the oil will actually ease out the pain with much more fastness. So also you can check for your postures. Majority of the time what we do is we shrug our back and we try to bend forward and then type the keyboards. We bend forward and try to lean. All our postures, even through walking, our backs are not generally straight. So there are support structures which you can actually wear, like a support for your shoulder, a support for your back, that will make sure that whatever happens, your back is straight and you maintain that curvature of the spine no matter what is your activity. So generally when you sit straight, you could feel that your spine is having a slight curve inwards and then comes out of the lower aspect of your body. So if these mechanisms are put into practice, then the so-called problems to your spine reduces. So even if you had any kind of a treatment or any kind of a, let's say, surgery, before that you can just use the support for a few days and have a look. So the 2 weeks of a rest, you can actually wear a support, give a support to your back and see whether it works much more or eases your pain much more better or eases your pain with much more ease. You can also see to it that you do some movements. So some movements are basically needs you to bend forward, like that of, let's say, cleaning, like that of washing your clothes, like that of wiping or mopping the floor, or anything, even doing some servicing to your bikes or cars or washing the cars or anything. Generally, we are in an rightful nature to move forward or bend forward and try to do the works, even for writing. The same time, after that practice or after that activity, see to it that you give a little bit of back stretch. So when you're trying to give a little bit of back stretch, the body tries to ease out or balance out the negative effect of the forward bending, at the same time damaging or reducing the damage to the spine as well. So these are a few things which you can actually do at your home without any interventions of doctor. But yes, if it is a very mechanical kind of a thing where many other things are there, you obviously need some of the x-rays, MRIs and all those things to have a decisive information about what exactly is the problem in your back. So these are the few things which you can actually practice. So keeping my talk short and trying to give you more remedies for your back pain, we have come to the end of the session. So any questions, any doubts? I don't want to give more information. At the same time, I want to curtail limited amount of information because not every back pain is same. It looks like it is very simple. The back, as I have discussed, is a lot of reasons why you can have a back pain. But the most important reason is, are you having the same pain? Because it might be because of any other thing. If you can always share your problems. You can write it down at dr.adityahande@gmail.com or dr.adityahande@gmail.com. Or else you can even drop your valuable feedbacks, and you can also drop down your problems onto the section in comment below. At the same time, you can also subscribe to the channel and also forward this to the friends who are in need of it. So coming up, we will be coming up with more of yoga, naturopathy, and mindfulness, and trying to cover majority of the diseases which commonly we see. Our aim is to, or my aim is to make you aware of the problems which you come or encounter in day-to-day life, but you try to miss out the important tips or bits which can actually help you in resolving your problems. So till then, make sure you keep your backs fit and make sure you are healthy and you stay safe. Thank you.